Hello, I am Dr. Kodlady Surendra Shetty, consultant spine surgeon at Spine Care Hospital, Magdi Road, Rajaji Nagar, Bangalore. Yoga is very good for any disease, so for the back pain also. But we have to filter which type of yogic exercises is best for a particular patient. So all this is done by observing his scans, MRI scans, as well as the X-rays, especially the bending X-rays. So after looking at the deformities in the bending X-ray, then we can decide which type of exercises he has to do. Whether he has to do forward bending exercise, whether he has to do backward bending exercise, or whether he can do both type of exercises. All depends upon the findings in the standing MRI. That is why all yogic exercises are not good for the back pain patient. We have to filter, we have to find out. For example, if a particular patient has got forward shifting of the bone, one bone over the other in bending X-ray, then he has to avoid forward bending. He can do backward bending. Likewise, we have to tailor the exercises, whether to do backward bending exercise or both exercises. Sometimes when there is no instability and the stiffness is the main problem, then they can do all sort of exercises. All sort of yoga can be done, but not for everybody. So it should be individualistic and it should be tailored to the particular condition of the patient. Not all back pain patients are equal. Not all back pain patients cannot be recommended with all type of yogic exercises.